Long-term disability insurance claims by physical therapists. I know you've worked hard and long to become a physical therapist, and you take great pride in helping people recover their functionality, but now you're on the other side of the table. It might be that you have a degenerative condition, sustained an injury at work, or in an accident, or you may have developed a debilitating medical condition, any of which can impact your ability to work as a physical therapist. Now, hopefully you have purchased an individual disability insurance policy, a policy through your state physical therapy association, or you are covered under an ERISA disability policy that you've purchased through your employer. Now, long-term disability benefits can provide you and your family with a source of needed income while you're recovering and hopefully be able to return to work as a physical therapist. But I will tell you that it isn't easy to get your benefits, and you should be consulting with an experienced ERISA disability long-term attorney or an IDI attorney before you stop work and apply for benefits. Now, I think we need to think first about the occupational hazards for physical therapists, and you're at an increased risk for developing work-related musculoskeletal disorders of the back, shoulders, and wrists because of the repetitive nature and tasks of your employment. Now, you're obviously on your feet most of the day. You're bending, you're stooping while you're examining patients. You might be setting up equipment, you might be demonstrating exercises. You're probably moving patients while on the treatment table. And obviously you're doing hands-on therapy. And at the end of the day, when you catch a moment, you're going to be charting the patient's physical therapy visits. So you're going to be doing some typing. Lots of standing, walking, bending, stooping, lifting, with some sitting. Now, what you're doing, obviously, is to use your brain also to formulate a treatment plan, and you're interacting with the family and the patient. I think all of this is particularly important because you have seen in your practice people who have become disabled and are fighting with workers' comp carriers, they're fighting in a personal injury lawsuit, they might be fighting in an ERISA disability claim. So one of the first things I think you need to do is to get out your disability policy and read it cover to cover. You're looking for a couple definitions. One is a definition of your occupation. The second is a definition of disability. And the third is a definition of what I call, or what is called, an elimination period. You need to understand what you have to prove and potentially how long you have to be out of work before you collect benefits. More importantly, I think that you need to be looking at your medical records to make sure that your medical records are documenting the nature of your medical condition. Some disability policies will limit benefits based on whether you've had an accident or a sickness, and so you want to understand policy limitations. Your plan also, or policy, might have a limitation for subjective medical conditions. Now you're thinking, well, geez, I have a herniated disc in my neck. That's not subjective, but I will tell you that sometimes there are policies that will say after 2 years of benefits that your benefits can be limited if there is no longer objective evidence of an ongoing disability. So you might have had back surgery and have pain, but your MRI shows a repaired disc. Your EMG and nerve conduction study tests are normal. So you can see there's a lot of homework that needs to go in, to be done, if you will, before you stop work and apply for benefits. Give us a call at 727-894-3188 if you have any questions about your disability policy and your rights to your disability benefits. I can help you regardless of where you live in the United States, regardless of the nature of your medical condition, and regardless of whom your carrier or plan might be. 727-894-3188.